It's time for Morton in the Morning on WVBF, a weekly get-together with your friends at Morton Hospital. Coming to you every Wednesday at 11:05 a.m., Morton in the Morning brings you full access to the latest hospital news and health information. Stay in the know about important health and wellness topics, new doctors and services, and upcoming events, and get to know the team at your community hospital. And now, Morton in the Morning.
Good morning, everyone. Happy Wednesday, and welcome to this week's episode of Morton in the Morning. I'm your host, Julie, and we are coming to you right here from Morton Hospital, your community hospital in Taunton. And we join you every Wednesday at 11:05 a.m. right here on WVBF, your hometown radio station. We have another new show for you today, and we hope you enjoyed our new show last week, which featured Hannah, a student in our nutrition services department. And Hannah joined us to talk about plant-based proteins. If you missed that show, you can find the link on our Facebook page, as well as all the other links of our past shows as well. So we're excited to bring a new show to you today, and we wanted to do this show because coming up in April, it's National Donate Life Month, and we have a great partnership with New England Donor Services. So let's dive into today's show, and at the end, we have some updates, including a reminder about our hiring event this coming Friday from 9 a.m. to noon and 2 to 4 p.m. So we'll talk a little bit about that if we have time at the end of today's show. But we have a lot of great information to cover and a lot of great education to provide about organ donations. So we're going to get started with the interview portion of today's show. So we have a special guest today, and it's from one of our community partner organizations, New England Donor Services. And our guest is Ingrid Palacios, and she is the Multicultural Outreach Program Manager for New England Donor Services. So Ingrid, thank you so much for joining us, and you're actually joining us over the phone.
Yes, I am. Thank you, Julie, for inviting me.
Yeah, we're so happy to have you because it is National Donate Life Month, so there's so much education that we want to provide about organ donation. So first, tell us about yourself and your background and also your role with New England Donor Services.
Well, like you say, my name is Ingrid Palacios. I'm the Multicultural Community Outreach Program Manager for New England Donor Services. I've been working in the field of donation and transplantation for the past 12 years. First, I started working as a family services coordinator, working with families at the hospitals when they were losing a loved one. I had the honor and the blessing to be able to be the one person speaking to them about the very unique and wonderful opportunity for the loved one to become an organ donor. So that's what I did for 8 years. And then after that, I transitioned to do community outreach, and then now a program manager of community outreach, where I develop cultural intelligence programs in different languages, specifically in Spanish and English, to educate multicultural and diverse groups in the communities of color, about donation and transplantation. So our goal is to inform and educate our communities of color about donation and transplantation, so when the time comes, they can make an informed decision if they would like to save lives through organ and tissue donation.
Okay.
So that's what I do. Mm-hmm.
Wonderful. Well, it sounds like a lot, and it sounds like you're probably very busy and an essential role there with New England Donor Services. And, throughout our discussion, I might refer to New England Donor Services as NEDS, because that's the the short pronunciation of it. So why don't you tell us more also about NEDS in general, what they do?
Yes, and so like I was saying, I had the honor to work for an amazing organization such as New England Donor Services. New England Donor Services is the organ procurement organization assigned by the federal government to serve the region of New England. We serve the 6 states of New England: Massachusetts, Connecticut, Maine, New Hampshire, Rhode Island, and Vermont, as well as the island of Bermuda. We serve about 15 million people and about 200 hospitals and 14 transplant centers. So we are one of the 56 organ procurement organizations assigned by the federal government to procure and recover organs with the purpose of transplantation and saving lives. So that's our mission: save and heal lives through organ and tissue donation.
Wonderful. Okay. So why is it important for our listeners out there and just for anyone in general, why should you consider being an organ and tissue donor?
So knowing the numbers, I think it helps to paint the picture on what is important. There is over 104,000 men, women, and children waiting for an organ to survive here in the United States, waiting for an organ transplant. And so just having that and picturing that, knowing that 2,000 of those people are children that are there waiting for a heart, waiting for a kidney, waiting for a liver, in order to have a second chance in life. I think it's important for us to realize that. For our communities of color, it's also important to know that 60% of the people that are in the waiting list are people of color. Mm-hmm. And so that is not something that just happened to, other people, or sometimes we haven't been exposed to the need of organ and tissue donation. And so learning these numbers makes it real, makes it click, I feel.
Yeah.
Like, wow, there is so much need out there for organs.
Absolutely. Those numbers are actually staggering, how many people are waiting for that. And I think, unfortunately, it's one of those things that, we don't necessarily think about unless we get a driver's license and it asks us if we want to be an organ donor, or unless we actually have a loved one that is waiting for an organ or a tissue transplant. So I think this is really important that we're bringing awareness to this, because it is something that everybody should be, thinking about and willing to do.
Absolutely. And part of our end of life decisions, that is something, this is a conversation that needs to be taking the stigma out of it. And actually, this is something that I always encourage people to discuss with their families and inform their families about that decision. Because a lot of people, and we see this, Julie, a lot of times when someone passes or someone is about to be declared brain dead at the hospital, and the families are not aware that that person actually has signed up as to be an organ donor. And so sometimes we get a lot of relief that the families don't need to make that decision. It takes a burden out of your families knowing, okay, this is what my loved one wanted to do. What I want to do is to honor those wishes.
Absolutely. And so that's why it's important to make that decision in advance. But are there often a lot of patients that haven't made that decision until the end of their life?
Yes. And sometimes it's not that they haven't made that decision. Probably in their minds, they know what they want, or in their hearts, but because of some common myths and misconceptions that are out there, sometimes they're afraid to register. We get that a lot when working in the communities. A lot of people say, when I die, something happens to me, I want to save life, I just don't want to register because I'm scared of some of the misconceptions that are out there, and I don't know if you want me to talk about that right now, or you wanted to talk about it later.
No, I definitely want to get into that. But first, we actually do have to take our first break of today's show. So if you're just tuning in, we're here with Ingrid Palacios from the Multicultural Outreach Team at New England Donor Services, and we are talking all about organ donation and how important that is with the number of donors that are waiting on a list for organ transplants. So we want to provide some education for you today, and we have much more to come with Ingrid. We're just going to take a quick break, and when we return, we will talk much more, go into many other topics, including how you can register to become an organ donor if you haven't already identified yourself as one. So stay tuned. We'll be right back after this short break.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
Need a primary care provider? Morton Hospital and Steward Medical Group have welcomed 3 new doctors to our community. Dr. Margaret Sywinska and Dr. Yelena Levin have joined our Steward Primary Care of Taunton practice located on Bay Street. For an appointment, you can call 774-501-3229. And Dr. Joanne Sylvia is now seeing patients at Steward Primary Care of Lakeville, seeing patients of all ages. For an appointment, call 508-947-4400.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Good morning, everyone, and welcome back to Morton in the Morning. If you're just joining us today, we are doing a show in honor of National Donate Life Month, which is coming up in April, and we are talking about the importance of organ and tissue donation. And we have a special guest over the phone. Her name is Ingrid, and she is representing New England Donor Services. And before we took our break, we were talking a little bit about the Multicultural Outreach Team, about what New England Donor Services does in general, their mission. And we were also talking about, people that have made the decision to be an organ donor. If someone hasn't already made that choice, how do you register to become a donor?
So it's very easy. Nowadays, as you mentioned, when you go and get your driver license, you're going to get asked, if you want to become an organ donor. And so that's, the old way, the way that it's always being done, and it's still being done. However, now it's easier than ever to register. You can register online.
Okay.
There is a site, the national site is registerme.org, and it takes you literally seconds to register.
Wow.
You click there, and it takes you seconds. And also for people that use iPhone users, you can use the Health app in your iPhone and register also in a matter of seconds. So it's very, very easy to register as an organ donor.
Okay, so registerme.org. That's pretty simple.
Yes.
Perfect.
Very simple.
All right, so let's definitely get into some of those myths and misconceptions that you had hinted at.
Yes, and so one of them being, and this is what I was making reference to, a lot of people say to me in the community, and this is across different cultures, okay? This is not specific for one group. I think the most common myth that I hear is, if I am registered or if they see I have the heart in the license, if something happens to me because of an accident or because of an illness, the hospital won't save my life in order to take my organs. I don't know if you have heard that, but I hear that a lot everywhere. Even when I'm in an Uber, talking to the Uber driver, it's like, I would like to be an organ donor, but I don't want to register because, And so I just want to clarify that, and Julie, you work in a hospital and you can talk about this even better than me. The oath that the doctors do and swear by, and which is saving the lives of the people that are under their care, right?
Absolutely.
And so when you go to the emergency room because you had an accident, the least thing that these doctors are thinking is to be, they are not even, they won't even have access to the national data to know if you're a registered donor. Mm-hmm. You know what I mean? So they will be doing everything to save your life. And also it takes so many different and unique circumstances that you have to be on a ventilator, there's so much criteria that needs to be happening in that moment for you to even be considered an organ donor. Just keep in mind that it's like there are like 85 million people in the United States that are registered as organ donors. Only less than 4% actually become organ donors.
Oh, wow. Because
they don't die in the circumstances necessary to become an organ donor, or because their organs are not even suitable to be transplanted.
Okay.
So there's such a process that gets involved into finding the match for those organs, doing all the tests and examination necessary to deem someone as suitable for organ donation. And so the answer then, the reality, the fact is that if you're registered and you go to the ER, There's no way that the people are going to kill you or are going to take your organs,
right,
in order to save other people's lives, because that's not how it works. We need to be involved. New England Donor Services, the clinical staff in New England Donor Services are actually the ones that, in collaboration with the hospital, do the testing necessary. It's a specialized team. It takes a lot of people, to determine this. So don't be afraid to register as an organ donor and share that decision with your families. That's what I want to say. So that's one of the most common myths. I don't know if you have heard that one before, Julie.
I have not, but I mean, it does make sense. But yes, we will always work to do what we can to save any patients here at the hospital, unless it's documented as a medical wish of the patient that they not be resuscitated in any given situation.
Exactly. In that case, then you guys will call us. We will get involved. So it's not something that happens, how people think. There's a lot of misconceptions also because of Hollywood or the media, stories that are out there that are very good for Hollywood, but they're not completely accurate.
Right.
And so people get these ideas. Another one that I hear a lot is like, I am too old to become an organ donor. And I want to clarify this for our audience that our oldest donor that we had was 95 years old.
Wow.
And so, and so I always say there is no limit for someone to save lives. There's no age limit. And so it's going to depend on how well and how good the organs are at the time of someone's demise.
Mm-hmm.
And so don't rule yourself out thinking, oh no, Ingrid, I would love to, but I'm too old to become an organ donor. You don't want my organs. I hear this often. And I say, you have no idea. Maybe I don't want your organs. But the people that are there in the waiting list, the children, the wives, the husbands, the moms that want a second chance in life, they will want your healthy organ to be able to continue their lives. And so don't rule yourself out. Let the specialist, let the clinical team to determine if your organs are suitable for donation, and you might be able to save lives. From one person, Julie, 8 people can live. From one person, one organ donor, you can save the lives of 8 people with organ donation, and over 75 lives can be transformed through the gift of tissue donation.
That's amazing.
It's important,
Yeah, that's motivation enough.
Yes, these are the things that's what I'm saying. I wanted to share some facts, some information that we don't think about it, and that, hopefully some of these resonates with our community that are listening. Another one that I hear a lot is my religion doesn't support organ donation.
Okay.
And so this is something that we get a lot, and it's usually when we are at the hospitals, when we are in the community, we involve and we work very closely with faith leaders. So people get the guidance from their faith leaders and not from us. However, I can tell you that it's being studied that the majority and the major religions in the United States support organ donation. And if they don't have anything out there in support of organ donation, they don't have anything against it. On the contrary, they leave it to the individual to make that decision, or they think it's the ultimate gift that you can give to your neighbor or to the person, to another person. Like Pope Francis, for example, for Catholics, right?
Yeah.
He's one of the biggest proponents of organ donation, and one of the biggest supporters. And in my community, my Latino community, I hear that often. No, my religion, it doesn't support. And then when they learn that Pope Francis, this is what he's saying, and the support that he's giving, on the contrary, like, consider it like the ultimate gift of love that you can give to your neighbor, then hearts change, minds change. So that's one important one to also take into consideration. Another misconception could be that if I become an organ donor, my family has to pay for it. This is going to cost money to the families, and it's absolutely the opposite. All organ procurement organizations like mine, New England Donor Services, we cover all expenses related to the process of donation. So this doesn't cost a dime to the families.
Okay. Well, that's good to know.
I would say those are some of the most common ones. I don't know if you hear others, Julie, that you want to talk about, if you have heard any others.
Yeah, no, I think those are all very important, and like you said, probably the most common. And I did want to ask another question, because people are probably thinking, what types of organs and tissues can you donate? So maybe we could walk through what are the most commonly donated organs and tissues, and maybe what are the most needed.
Yeah, so the most commonly donated, only because it could be given as a living donation and deceased donation, will be the kidneys. Will be the kidneys. And that's also the most needed. There's almost 90,000 people of those people in the waiting list that are needing kidneys. And so that's to answer the first part of your question. And the second part, what organs can be donated? The heart, the lungs, the kidneys. The kidneys go to two people. So, because as you know, people can live with just one kidney. The liver can also be segmented and can go to two people. Usually a small segment of the kidney goes to pediatric cases, and the larger segment of the kidney, of the liver, goes to adults. Pancreas and intestine. Those are the organs that can be donated to other people, can be transplanted. Okay.
And now, how are the organs allocated? Because, it sounds like there are so many people on this waiting list. So what determines, who gets these organs when they're available?
So that's an important question. The main criteria being the organs go to the sickest person in the list. Okay. Right? And so other things are important, other medical factors and determinants are important that are have to take place for those organs to be allocated, which will be compatibility in the blood, compatibility in tissue typing on HLA, compatibility in size of the organs, and also demographics is another factor. So that the main criteria is that the organs will go to the sickest person that is compatible to the person that's donating the organ.
Okay. And to be compatible, and maybe this is another one of those misconceptions, but do you have to have some relation to the person you're donating to?
Not necessarily at all. However, we do in New England Donor Services what is called directed donation. And sometimes within a family, there is a family member that needs a kidney or needs an organ. And so that becomes a priority when it comes to the criteria where the organ is going to go. That becomes the priority. If that person is compatible with their family member, then the organ goes first to that person. Does that make sense? Yep. But a lot of testing needs to take place before to determine that, and sometimes that's not the case. A lot of times that's not the case. Even though they are related, they're not compatible. Okay. So, that's a good question.
Well, very helpful, Ingrid. I think really important to clear up some misconceptions about donation. You don't have to be related. In some cases, it does help to be related. You just have to be qualified, as Ingrid had said, and there are many criteria, and New England Donor Services can help you with that to determine if you are eligible to donate. So, as Ingrid said, you can register online at registerme.org. It's a very quick process and a very important decision to make. So it is just about time for us to take another break. But we are not done. We have a lot more questions for Ingrid. I want to talk to you a little bit more about how you work with hospitals like Morton Hospital and anything else you want the community to be aware of about New England Donor Services and organ donation. Before we take our second break, I just want to remind our listeners how you can contact us here at Morton in the Morning. You could reach out to us anytime at mortoninthemorning@steward.org. That's MORTON in the morning at STEWARD.org. We love to hear from our listeners, even if you want to just send us a note to tell us how you're enjoying the show. If you have any follow-up questions, maybe you missed something, a phone number, we'd be happy to get back to you via email, or of course you can call the hospital at any time. And we also want, we're always willing to hear your suggestions. What do you want to hear about on future shows? So email us anytime at mortoninthemorning@steward.org. And if you've just tuned in and you have missed the first half of the show, we've been talking about organ donation. But don't worry, we always post our shows on our Facebook page. So they go up on YouTube, and we put the link on our social media pages so you can listen online after the show airs. If you search for Morton Hospital on Facebook, or just type into your web browser facebook.com/Morton Hospital MA. So again, it's time for our second break. We're halfway through today's show, but when we come back, we will be here with more with Ingrid from New England Donor Services. So please stay with us. We'll be right back after this short break.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
At Morton Hospital, we're proud to be nationally recognized for quality and safety. In addition to recently achieving the Gold Seal of Approval and accreditation from the Joint Commission, the Leapfrog Group has named us as a straight A's hospital for having received 5 consecutive A hospital safety grades since 2020. To learn more about our achievements and awards, visit mortonhospital.org.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Good morning, everyone, and welcome back to the second half of today's Morton in the Morning show. We have a special show today in honor of National Donate Life Month, which is happening in April. And our guest is from New England Donor Services, and we've been talking about the importance of organ and tissue donation, the types of organs and tissues that are most commonly donated, and who's qualified, and also some stats about the list of people that are waiting for those organ transplants. Now, I know you said that New England Donor Services works with hundreds of hospitals. So how do you partner with hospitals, and how does that process work when someone unfortunately does pass away and they are an organ donor? Walk us through what happens then.
So it's a process, right? We work with almost 200 hospitals in all the New England states, and what happens is that the hospitals are mandated to call us if someone is about to be declared brain dead, or end-of-life decisions are being made, or the family is talking about taking the patient from life support, and the hospitals, know that the criteria could be met for someone to be evaluated for organ donation. They just give us a call. We dispatch a clinical team to the hospital to do the evaluation necessary, initial evaluation necessary, just to see that a patient is suitable for donation. If it's not suitable for donation, then we, in many cases, we don't even talk to families unless the patient is a registered donor and the family wants to talk to us. And if the patient is suitable for donation, then a family services coordinator is also dispatched from our team to go and talk to a family. Is a registered donor, then to talk about what process is to follow and to honor that person's wishes, or if the patient is not registered, to talk and inform the family about the opportunity for their loved one to become an organ donor. So we support the family throughout the whole process. If we're moving forward with donation, because it's being determined that the person has been declared brain dead, and which we are not involved in the brain death declaration, that comes from the hospital. We work very closely with the hospitals elaborating the best plan to support the family during the process of losing the loved one and becoming organ donors. And so that's what we do very closely. We have hospital relations coordinators that work with every hospital that are there weekly, teaching, talking, and sharing best practices to serve the families in the most compassionate and professional way possible. Our process usually takes a couple of days, 36 to 48 hours. So we are on site, our clinical teams and our family services teams, working with the hospitals, everybody that is involved in end of life with family, social workers, chaplaincy, interpreters, and of course the medical team. Mm-hmm. And so during that time, we're doing all the testing necessary. We're doing the matching, finding the compatible patients for the organs, and preparing everything to go to the operating room to recover and procure the organs. Okay. And then the transplant teams come from different hospitals to the hospital where donation is taking place. And so it's a complex and it's a long process, but our collaboration and our partnership with hospitals like Morton Hospital are key in order to make donation happen, in order to give someone another chance of life, and in order to honor the wishes of a person that had decided to save lives through the gift of organ and tissue donation.
Okay, so my next question is, do you have any stats that you can share about donations that have been made by Morton Hospital, and then maybe even some national stats about donations?
Yes, of course. Over the last 5 years, there have been 6 organ donors in Morton Hospital.
Great.
That has resulted in 12 organs transplanted and 47 tissue donors.
Oh, wow, that's amazing.
That's amazing, yes. We talk a lot about organ donation, but tissue donation is, as important and life-saving and life-transforming as organ donation. And so in 2022, we had 2 tissue donors, 1 organ donor, 1 organ was transplanted. In 2021, we had 1 organ donor, 2 organs transplanted, and 21 tissue donors in Morton Hospital.
Okay.
And yes, and so we, as you know, we have our hospital relations coordinator, Jolieanne Driscoll, that works there and is like our liaison for New England Donor Services, the one that does the education and continues elaborating and supporting best practices and implementing best practices to better serve our families in Morton Hospital.
Yeah, and she's a great advocate. She's wonderful to work with.
She's amazing, right?
Yes.
She does a lot, and Morton Hospital is one of her hospitals that she's very proud of the work that we're able to do there. So nationally, I'm happy to share with you that we have been, I think last year was the 12th year in a row that we have been breaking records in donation and transplantation. In 2022, we were able to perform nationally 42,800 transplants.
Wow.
Nationally, and that puts us in the lead in the world as the most transplants per million population in the world. So we're very proud of being part of that. New England Donor Services, of course, as one of the 56 organ procurement organizations. And again, this is not only New England Donor Services or the organ procurement organizations, but the system as a whole. Mm-hmm. That includes hospitals, that includes transplant centers, and everybody and everything that is involved in the process of transplantation. So that's something exciting to share with you.
Yeah, that's
so
amazing.
When it comes to, yes, and then last year we made a new record in New England. We had 492 organ donors, and we were able to do 1,325 organ transplants from deceased donation. And so that was just solely in the New England area. And, Morton Hospital is also part of those numbers. So
yes.
I wanted to share those exciting numbers. We have still a long way to go because there is, every day 17 people die waiting for an organ that they, never received. And so that's why it's important that we are doing this work, Julie, that we're doing together, educating and raising awareness for people to know how important is to become an organ donor across all communities, across all cultures.
Yeah, well, that's amazing, and congratulations on those records, and thank you so much to the team for just such the important work that you do every day. Yeah. So I want to go back, we're getting close to the end of our time, but just to when you were talking about the mission of the Multicultural Outreach Program, so what initiatives do you have in place to advance health and social equity in donation and transplantation?
Yes, and so we have a couple of things. We have the Multicultural Outreach team, which I'm part of. Mm-hmm. We are small but mighty. What we do is we work and we develop culturally sensitive programs to work with communities of color, historically marginalized groups, and underserved populations throughout New England. And so we are out there you will see us in the media, you will see us in the community, health fairs, the schools, speaking events, churches, health fairs, you name it, we are there. Outside in the community a little bit more this year because during the pandemic it was very challenging to literally be in the community. However, we were able to do that through the power of technology and all the virtual era that, the resources that we were able to use. We do this in different languages. We have resources, we develop materials in different languages. And as part of social equity, specifically when it comes to that, New England Donor Services, after the killing of George Floyd in 2020, they created a social equity work group. Now it's the Social Equity Steering Committee. I'm a founder member, and I'm very proud to have that as an initiative of the whole organization. It's actually one of our organizational goals. And it was born to help eliminate racial disparities when it comes to access of donation and transplantation. Mm-hmm. So as a public health organization, we felt it was our responsibility to take the lead and to also move, the needle when it comes to disparities in donation and transplantation. And so we've been working every year very hard and very proud on doing that, doing this in the regional and national level. So part of that, for example, is like a couple of years ago we launched our website completely in Spanish.
Okay, nice.
So you can find us in nets.org or nets.org/es, which is Espanol.
Yeah.
We also have in our aftercare program, we have an aftercare program website. We have everything in different languages. You can also, one of our events that became a signature event of us, and I'm very proud also because that was one of my projects and one of my main proposals when we created the social equity work group was an annual symposium that we have for professionals in the field of donation and transplantation. We have the first year, Julie, we had 500 people attending our symposium.
Wow.
It's a virtual symposium, so it's open nationally. It doesn't cost anything. We have a panel of multidisciplinary and multicultural professionals, specialists in the field of donation and transplantation, that are leading the way nationally and regionally in eliminating racial disparities and increasing access for donation and transplantation for communities of color. And we have been able to highlight their work, their best practices, their programs, and people nationally are recreating that, learning from that and recreating those practices. So you can imagine the ripple effect. The feedback has been amazing. We provide CMEs, we provide CEUs. So Yes, so the first year we had like 500 people attending. The second year, last year, we did it all based on kidney donation, allocation, transplantation. We also had like about 300 people attending, and this year it's going to be in September. So it's going to be something exciting. I welcome you, Julie, and the people from the staff from Morton Hospital to also join that symposium, because it's really, really, I'm very proud. I get so excited talking about this, because it's really an amazing initiative, and have all these clinicians, social workers, nurses, joining these panels and joining the conversation. You just learn so much. You're like, it's empowering, it's invigorating, it's inspiring, and so that is something that we became the change that we wanted to see. Pretty much.
Well, I can hear the passion in your voice, and you are just doing such amazing work, and I'd be happy to share the information about that symposium with our staff once you have that. If you wouldn't mind sending that to me, that would be great. And Ingrid, we actually have to take one final break, and I'm so sorry. I have a couple more questions for you when we come back, but time for our last break of today's show. We'll be right back after this short commercial break.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
Need a primary care provider? Morton Hospital and Steward Medical Group have welcomed 3 new doctors to our community. Dr. Margaret Sywinska and Dr. Yelena Levin have joined our Steward Primary Care of Taunton practice located on Bay Street. For an appointment, you can call 774-501-3229. And Dr. Joanne Sylvia is now seeing patients at Steward Primary Care of Lakeville, seeing patients of all ages. For an appointment, call 508-947-4400.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Good morning, everyone, and welcome back to Morton in the Morning. We had a great new show for you today, and our guest is still with us over the phone. Her name is Ingrid Palacios, and she is with the Multicultural Outreach Team at New England Donor Services. And today we've been talking all about organ and tissue donation. It's such an important topic, and we've been very, very happy to raise awareness about it and also dispel some of those common myths and misconceptions about organ donation. And Ingrid has just been an incredible guest with a wealth of knowledge. Before we end our time, again, this has been wonderful, such great information and education. I love, where you sort of debunked some of the many myths associated with donation. Is there anything else in general you want the community to know about organ donation or about NEDS?
So one thing I want to add real quick, we also have our social media in Spanish,
Okay.
Done Vida New England, that people can, connect with us. There is, a big Spanish population that we serve here in New England that is Spanish speaking only. So that is also available, Done Vida New England, in Instagram and Facebook. But I want to add, and I want to, just leave people with a reflection of how important is organ donation for everyone. And like I always say, if you find it in your heart of hearts, this is something that you would like to do, don't rule yourself out.
Mm-hmm.
Let the specialist at the end to determine if you could or could not be an organ donor. Remember, this is a personal decision. We're very respectful of that. We're only here to share information, and then people will, make that decision. If you want some more information, you can visit our website. Like I said before, neds.org, and in Spanish, neds.org/es.
Okay.
So, and I'm always, available to talk to anybody if they want to connect with us through our website or through our 1-800. And Julie, thank you so much for inviting us today
Yes.
to share this for National Donate Life Month. It is important that we connect with our, communities, and that we are available to share this knowledge.
Yes, and thank you. So much great information. And another important thing that you had mentioned, it only takes about 30 seconds to register.
Yeah.
And the website again was registerme.org?
Yes.
Okay.
Yes, 38 seconds. Mm-hmm.
Wonderful. Okay, well, Ingrid, it's been a pleasure to have you on our show today, and thank you so much for all the great information and all the wonderful work that you and the NEDS team are doing.
Thank you, Julie, for inviting us, for also the amazing work that Morton Hospital does with us. We're very, very grateful of our partnership and collaboration, and we hope that we can continue doing this sometime soon.
Absolutely. Thank you so much.
Thank you.
All right, well, that's all the time that we have with Ingrid. We want to thank her so much for being part of our show. It was really nice to have a community partner join us for our Morton in the Morning show. I think that may be the first time that we had an outside person come and join us that was not from one of our own departments. So maybe if we have some other ideas for future shows, we'll be happy to have some other special guests on in the future to talk about what's going on in the community. So thank you to Ingrid. Again, if you want to become an organ and tissue donor and you aren't already, you can go to registerme.org. As Ingrid said, it's a quick process and it only takes about 30 seconds. And if you, for some reason, missed part of today's show, don't worry. You can listen to the whole thing online on our Facebook page. Go to facebook.com/Morton Hospital MA, or if you're already on Facebook, just search for Morton Hospital. And we post all of our shows, a link to them on our Facebook page, so that will be up by this weekend. So for the last few minutes of our show, I just want to remind our listeners about our March 31st hiring event that is coming up this Friday. We have 2 sessions. We have a morning session from 9 a.m. to noon and an afternoon session from 2 to 4 p.m. That is a walk-in, in-person hiring event right here at Morton Hospital, 88 Washington Street, and it's for all of our open positions. So all nursing positions as well as all ancillary department positions, and we have many great opportunities and careers here at Morton Hospital that are currently open that we are looking for qualified candidates for. So we just ask that you bring a copy of your resume to the event. You'll check in with someone from our human resources team, and then you'll have the chance to interview on the spot with one of our managers in whatever department you're interested in joining. So it's a great opportunity to come in and meet our team, interview on the spot, and we might even be extending some offers. So please join us this coming Friday. Bring your resume. Everyone who comes in will have to wear a mask while you're in the hospital. And a couple of other incentives to highlight. We have some sign-on bonuses available. So sign-on bonuses for new staff RNs, as well as a new sign-on bonus opportunity through the end of May for respiratory therapists. So that bonus is up to $15,000 for full-time positions and up to $10,000 for part-time positions. But we have so many career opportunities available for you to sign up for. So you can look at all of our jobs at jobs.steward.org and browse through and see all of our open positions. You can also apply online. You can also register for the hiring event through the link on our Facebook page, but you don't have to because walk-ins are welcome. So just come right in anytime, 9 to noon and 2 to 4 p.m. this coming Friday, and we would be happy to see you there. New nurse graduates are welcome as well. And then if you're a nurse that joins our float pool, we do have an extra incentive for float pool RNs. Anyone who joins that float pool will get an extra $7 an hour for being part of that float pool. So great opportunity there. But like I said, if you can't join us in person on Friday, you can apply anytime online at jobs.steward.org. It's an easy process, and someone from our HR team or a manager will reach out to you if you're qualified to schedule an interview. But we hope to see many of our community members here at the hospital this Friday for our in-person hiring event. So that pretty much wraps up today's show. Before we end, I just want to remind our listeners how you can reach out to us. If you have any feedback about our show, you can send an email to mortoninthemorning@steward.org. That's MORTON in the morning at STEWARD.org. And I personally check that email address. You can send us feedback, you can send follow-up questions, or if you have any suggestions for health and wellness topics that you'd like to hear about on an upcoming show, we would love to hear those suggestions as well, or any guests that you'd like to have on. In the coming weeks, we're hoping to have some of our new doctors or some of our providers on our show, as well as some other special guests. So we appreciate everyone joining us. Again, we are here every Wednesday at 11:05 a.m. right here on WVBF, your hometown radio station. And we hope you'll continue listening. So from all of us at Morton Hospital, we hope you have a happy and healthy week, and we look forward to joining you next week for more Morton in the Morning. At Morton Hospital, we're proud to be nationally recognized for quality and safety. In addition to recently achieving the Gold Seal of Approval and accreditation from the Joint Commission, the Leapfrog Group has named us as a Straight A's hospital for having received 5 consecutive A hospital safety grades since 2020. To learn more about our achievements and awards, visit mortonhospital.org.